A lot of it was trying to give back to the Latino community, especially the one that I grew up in. I grew up in the Logan Heights Mountain View area, and it's definitely one that has been hardest hit from the pandemic, but even before then had a lot of health disparities. So I figure if I could be a bridge between the two, healthcare and this community, then perhaps health outcomes could be a lot better for a lot of people. We basically just expected to not expect anything. And I think that's really set us up for in that mindset that when we're nurses, when we're on the floor, we shouldn't really have any expectations of how things are supposed to go. It's more being prepared and being flexible to anything that can happen. So I think the pandemic has really prepared for us, and it's really just set us up to view society as something that needs a lot of improvement as far as people's health, and we can be, you know, players in that change and in that societal movement to have better health outcomes for a lot of people. I think the virtual technology and all the alternative learning that we had was really helpful because it allowed us to kind of sit in on those situations and really pinpoint what we needed to improve. If we were there in person, yes, that's very valuable and that's very helpful, and that's what we're going to be, encountering in our daily lives. But the virtual alternative learning really did help have a lot of those concepts sink in, which I thought was really helpful. And having, the alternative portion of having some of our
You want me to
community
count
hours be
down?
vaccines was
All right,
really,
ready?
really amazing. And I think I will never regret or ever forget having the opportunity to vaccinate against something that was so crucial in this time.